X-Cel Atlantis makes scleral lens fitting as easy as 1, 2, 3. This short presentation describes the lens design along with the simplified 1, 2, 3 fit strategy. Atlantis is a great option for patients with irregular corneas, especially those who are unable to adapt to corneal GP lenses, have lens stability issues, or suffer from dry eyes. The Atlantis Simple Step Fitting Set, along with the easy-to-see diagnostic lens markings, differentiates this design. No difficult calculations needed. The 3 proprietary zones are controlled independently to produce a wide range of sagittal depths that allow the fitter to customize the lens-to-cornea fitting relationship. The first proprietary zone is the base curve, or central zone. Next is the Limbal Vault Zone, and in the periphery is the Scleral Zone. For your convenience, each diagnostic set contains 24 Atlantis lenses, the 1, 2, 3 fit guide, unpreserved saline, insertion and removal plungers, lap towels, and a take-home patient insertion and removal guide. The 15mm diameter diagnostic lenses come in 5 base curves, and the 16.5mm diameter lenses have 3 base curves. Each base curve has a standard clearance or sagittal height, along with 3 peripheries: standard, steep, and flat. For increased accuracy in determining the fitting relationship of each zone, the central zone is marked CZ, the Limbal Vault Zone LZ, and Scleral Zone SZ. Each zone is marked twice for easy viewing under a slit lamp in case the markings rotate underneath the lids. The central zone is designed to clear the cornea and comprises approximately 50% of the lens back surface. Our clinical research shows that the majority of eyes can be fit using just 5 different central zone vaults. The Limbal Vault Zone controls the vaulting effect over the limbus, but does not impact the overall sagittal height. This zone has a standard proprietary radius developed to work independently from the central zone. In addition to the standard radii, it's available as 1 flat, 2 flat, 1 steep, and 2 steep. Each change in the Limbal Vault Zone curvature modifies the effective zone depth by approximately 25 microns. The Scleral Zone is primarily designed to align with the sclera and provide sagittal height alterations by making changes to its curvature. The standard Scleral Zone is also available in a single flat, double flat, and single steep radius. Each change in the Scleral Zone curvature modifies the overall sagittal height. Steepening the periphery will add 50 microns of clearance, and flattening the periphery will decrease the clearance by 50 microns. Begin the fitting process by evaluating the patient's ocular condition, corneal shape, and profile. Knowledge of the corneal shape and profile will provide a better understanding of the lens fit, especially as it relates to the sagittal height relationship of the lens to cornea and/or the cone position. When choosing a lens from the diagnostic set, start with the C lens in a 15mm diameter for consistency. An optic section view provides the ideal perspective to evaluate the tear layer between the lens and cornea. Use the thickness of the cornea and/or the lens as a reference point to determine the tear layer clearance. The average corneal thickness is approximately 500 microns, and the average Atlantis lens thickness is about 0.25 millimeters thick, or 250 microns. In cases where there's corneal thinning, the lens is a more reliable guide to evaluate tear layer clearance. The ideal fitting relationship has the central zone completely vaulting the cornea with approximately 200 to 400 microns of clearance. The Limbal Zone should completely vault the limbus with approximately 100 microns of clearance. And the Scleral Zone should show uniform minimal clearance, 360 degrees around the lens edge. When making lens parameter changes, make changes to one zone at a time. For detailed problem-solving recommendations, refer to the 1, 2, 3 fit guide included with the diagnostic set, or call one of X-Cel's knowledgeable lens consultants for advice. The extensive base curve range in the 15mm, 16mm, and 16.5mm diameters will accommodate most of your patient needs. Powers are available in quarter diopter steps from +20 to -20 diopters. Atlantis is manufactured exclusively in Boston XO and Boston XO2 materials. These market-leading, high-decay materials are plasma-treated to enhance lens comfort, especially in the critical adaptation phase. And for long-term success, Boston solutions are strongly recommended to be used with the Atlantis Design. We'd love to earn your business. Try a pair today. There's no risk. Our no-risk policy allows for a 90-day full credit on 2 exchanges per eye and cancellation. With our paperless credit policy, there's no need to return lenses. Use the easy and reliable 1-2-3 fit strategy and choose Atlantis as your #1 scleral lens for irregular corneas.